Explain the process of conducting a risk assessment for workplace emergencies such as chemical spills. Include key considerations and regulatory requirements. Answer: a risk assessment for workplace emergencies like chemical spills involves the following steps. Hazard identification. Identify all chemical substances stored, used, or produced in the workplace. Review safety data sheets (SDSS) for potential hazards, including toxicity, flammability, and reactivity. Vulnerability analysis. Determine who might be harmed and how, including employees, contractors, and nearby communities. Probability assessment. Evaluate the likelihood of a chemical spill based on past incidents, operational procedures, and equipment reliability. Impact assessment. Assess potential consequences, including health impacts, acute toxicity, respiratory issues, environmental damage, and economic losses. Mitigation measures. Develop measures to minimize risks, such as secondary containment, proper labeling, and employee training. Regulatory requirements. OSHA's Hazard Communication Standard 29 CFR 1910.1200 requires that hazards be communicated via SDSS and proper labeling. EPA's Emergency Planning and Community Right to Know Act (ECRA) mandates facilities to report hazardous substances and have emergency response plans. NIOSH recommendations include chemical exposure limits and protective equipment guidelines. These assessments must be documented and reviewed regularly to ensure compliance and preparedness. Outline the key components of an effective emergency response plan. For a manufacturing facility prone to fire hazards. Answer: an effective ERP for fire hazards should include risk analysis. Identify fire risks. Flammable materials, electrical equipment. Emergency roles and responsibilities. Assign roles such as fire wardens, first responders, and evacuation coordinators. Evacuation procedures include clearly marked exits, evacuation routes, and assembly points. Communication protocols. Establish systems for alerting employees, contacting emergency services, and relaying information. Training programs. Regular drills and training for employees on fire prevention and response. Fire control measures. Ensure fire extinguishers, sprinklers, and alarms are functional. Regulatory compliance. Adhere to OSHA's Fire Safety Standards 29 CFR 1910.38. The RP should be updated periodically and after any significant changes in operations or facilities. Sarah, an occupational health nurse at a warehouse, is reviewing the facility's pandemic response plan during a simulated outbreak of an airborne virus. The plan requires quarantine for exposed employees, but no clear guidelines exist for essential workers needing to continue operations. Sarah must ensure both health and business continuity. What steps should Sarah take to improve the pandemic response plan, ensuring compliance with legal and ethical standards? Answer: Sarah should develop protocols for essential workers, create guidelines for personal protective equipment, PPE, workspace modifications, e.g. barriers and staggered shifts to minimize exposure, establish quarantine policies, define clear criteria for when employees must isolate based on CDC guidelines or local health authority directives. Communication strategies. Develop transparent communication channels for reporting symptoms, exposure, and testing updates. Health monitoring. Implement temperature checks and health screenings for all employees. Legal and ethical considerations. Ensure adherence to the Americans with Disabilities Act, ADA, and OSHA's general duty calls to provide a safe working environment. Training and drills. Train employees on hygiene practices, symptom reporting, and emergency contacts. Discuss the role of behavioral health programs in addressing shift worker fatigue and how they align with workplace health promotion initiatives. Answer: behavioral health programs for shift workers focus on sleep hygiene education, teach employees techniques for better sleep such as maintaining a dark, quiet sleep environment, circadian rhythm management, offer rotating shifts that allow gradual adjustments to work schedules, physical and mental health support, provide access to counseling and stress management workshops, nutrition and exercise programs, ensure access to healthy meals during night shifts and encourage regular physical activity, alignment with workplace health initiatives, improved productivity, reduced fatigue leads to fewer errors and accidents, regulatory compliance, aligns with OSHA guidelines for workplace safety, cost effectiveness. Studies show fatigue management programs reduce healthcare costs and absenteeism. How can occupational health nurses monitor the effectiveness of interventions for musculoskeletal disorders, MDS, in the workplace, and what metrics should be considered in this process? Answer: monitoring the effectiveness of interventions for musculoskeletal disorders, MSDS, involves evaluating both the clinical outcomes and the impact on workplace productivity. Key methods include Clinical evaluation. Use assessment tools like the Oswestry Disability Index or the Neck Disability Index to track pain levels and physical function. Conduct regular follow-up examinations to monitor the progress of treatment, e.g., physical therapy, workplace metrics, absenteeism and presenteeism rates. Monitor changes in the number of sick days taken and productivity losses due to MSO-related issues. Injury rates. Track the number of new MSD cases reported after the implementation of interventions such as ergonomic modifications or job rotation. Employee feedback. Surveys or focus groups can gather direct feedback from employees regarding the comfort and effectiveness of ergonomic adjustments or other interventions. Metrics to track return to work rate, the speed with which affected workers return to full duties post-treatment. Ergonomic compliance, percentage of workers using ergonomic tools or following safe work practices. Relevant guideline. The NIOSH musculoskeletal disorder prevention guidelines recommend tracking the effectiveness of MSD interventions over time using both qualitative and quantitative data. Sophia, an occupational health nurse, oversees health services for a large construction company. The company recently contracted an external provider to conduct pre-employment physicals and manage workers' compensation claims. However, there have been complaints about delayed response times and incomplete medical records from the external provider. What actions should Sophia take to address these issues, and what steps can she take to ensure compliance and improve service delivery from the external contractor? Answer: Sophia should take the following actions. Investigation and documentation. Review contracts. Examine the contract with the external provider to ensure clear expectations for performance, including timelines for physical exams and claims processing. Investigate complaints. Review employee records and conduct interviews with workers and internal staff to gather details on the issues they faced. Communication and feedback. Contact the external provider, discuss the issues with the contractor and seek an explanation for the delays and incomplete records. Provide feedback. Offer specific feedback on the gaps observed, such as missed deadlines or inadequate documentation, and request corrective action. Contractor performance metrics. Establish KP as key performance indicators. Define measurable expectations, such as completion times for physicals, accuracy of medical records, and the handling of workers' compensation claims. Conduct regular audits. Implement regular performance audits and quality checks to ensure that the contractor meets agreed standards. Alternative actions. If the issues persist despite corrective actions, consider terminating the contract and seeking a more reliable provider, ensuring a smooth transition with minimal disruption to the workforce. Regulation. Contractors providing medical services should comply with HIPAA regulations and the OSHA standards on medical surveillance, which mandate proper documentation and timely communication regarding work-related injuries. What factors should be considered when performing a health history and physical exam for a worker in a high-risk occupation, such as a firefighter or miner? Answer: when performing a health history and physical exam for a worker in a high-risk occupation, the occupational health nurse should focus on occupational exposure risks. For firefighters, assess risks related to heat exposure, respiratory problems due to smoke inhalation and stress. For miners, evaluate risks related to exposure to dust, noise, and heavy lifting. Pre-existing health conditions. Ask about any previous respiratory conditions, musculoskeletal issues, or cardiovascular concerns that may be exacerbated by their job. Job-specific functional assessments. For firefighters, conduct cardiovascular and respiratory function tests to assess physical fitness for intense physical labor. For miners, evaluate joint function and hearing capacity due to prolonged exposure to heavy noise. Mental health considerations. Consider assessing for post-traumatic stress disorder, PTSD, or other stress-related conditions that could be prevalent in high-risk occupations. Preventive measures. Ensure that appropriate screenings are included in the health assessment, e.g., pulmonary function tests for firefighters, hearing tests for miners. Guideline. The NIOSH guidelines recommend job-specific health assessments, especially for workers in high-risk occupations, to ensure that they are fit for the job and able to work safely. What are the key documentation standards that must be followed in an occupational health program, and how do these standards ensure compliance with legal and regulatory requirements? Answer: the key documentation standards for occupational health records include confidentiality. Occupational health records must be kept confidential in accordance with HIPAA guidelines, ensuring that only authorized personnel have access to sensitive medical information. Completeness and accuracy. Health records must be complete, accurate, and up-to-date, including documentation of health assessments, treatment plans, and follow-up care. OSHA regulations require that records of workplace injuries and illnesses be maintained for a minimum of 5 years. Timeliness. All medical records and reports should be completed in a timely manner, such as within a specified time frame following health assessments or after workplace injury is reported. Accessibility. Records must be accessible for audits or reviews by regulatory agencies, e.g., OSHA, and should be stored in a secure manner, such as in a locked file system or electronic health record system. Retention. According to OSHA regulations, health records related to work injuries, illnesses, and exposure must be retained for a period of at least 30 years or longer, depending on the nature of the condition. Why is it important to include both leading and lagging indicators when establishing KPIs for an occupational health program, and how should they be balanced? Provide examples of each type of indicator. Answer: including both leading and lagging indicators ensures a comprehensive approach to monitoring and improving an occupational health program. Leading indicators. These are proactive, predictive measures that provide insight into potential risks and help prevent incidents before they occur. Examples: number of safety training sessions conducted, percentage of employees participating in health screenings, frequency of hazard assessments performed. Lagging indicators. These are reactive measures that reflect outcomes or past incidents. Examples: number of reported workplace injuries or illnesses, average time to resolve reported incidents, workers' compensation claims filed. Balance. The balance depends on the organization's goals. Leading indicators are actionable and support prevention efforts, while lagging indicators evaluate the effectiveness of past actions. Best practices recommend a ratio of at least 60/40 in favor of leading indicators to drive proactive safety management. Relevant guideline. The Occupational Safety and Health Administration, OSHA, encourages a balance of indicators as part of a holistic safety and health management system. Maria, an occupational health nurse, is tasked with designing a new health clinic for a manufacturing company. The workforce includes 500 employees who perform physically demanding tasks, some involving exposure to hazardous materials. Management wants the clinic to provide first aid, health assessments, ergonomic evaluations, and a small pharmacy for prescription medications. Maria must also ensure compliance with all relevant regulations. What factors should Maria consider in designing the clinic, and what key features should she prioritize? Answer: Maria should focus on the following factors and features. Regulatory compliance. Ensure compliance with OSHA standards for workplace health services, adhere to state and federal laws regarding medical waste disposal and confidentiality of medical records, HIPAA, facilities and layout, dedicated rooms for treatment, health assessments, and ergonomic evaluations. Proper ventilation and storage for hazardous materials and medications. Emergency equipment such as automated external defibrillators, EEDs, and oxygen tanks. Services offered. First aid. Stock first aid supplies and ensure quick access. Health assessments. Include equipment for vision screening, pulmonary function tests, and audiometry. Ergonomic evaluations. Ensure space for demonstrations and ergonomic tools. Staffing. Hire trained health professionals, including nurses certified in occupational health. Accessibility. Designed for easy access by employees during all shifts. Compliance with Americans with Disabilities Act (ADA). Maria should draft a proposal detailing these elements and consult with regulatory bodies to finalize the design. Explain how evidence-based treatment protocols improve outcomes for workplace injuries and provide an example of their application in managing musculoskeletal disorders. Answer: evidence-based treatment protocols improve outcomes by ensuring interventions are backed by scientific research and clinical evidence, standardizing care to reduce variability in treatment quality, enhancing patient recovery through proven strategies. Example: managing musculoskeletal disorders (MSDS). Assessment: use validated tools such as the quick disabilities of the arm, shoulder, and hand to measure severity. Intervention: apply evidence-based therapies like physical therapy, ergonomic adjustments, and non-steroidal anti-inflammatory drugs. NSAIDs. Monitoring: regularly assess progress through range of motion tests and pain scores. Relevant guideline: the National Institute for Occupational Safety and Health (NIOSH) promotes evidence-based approaches in occupational health practice. Tom, a construction worker, reports numbness and tingling in his hands. His job involves operating heavy vibrating equipment for extended periods. He is concerned the condition might be work-related. What steps should the occupational health nurse take to evaluate and manage Tom's condition? Answer: assessment. Take a detailed health history focusing on symptoms, duration, and work tasks. conduct of physical examination to assess hand strength, sensation, and range of motion diagnosis. Suspect hand-arm vibration syndrome has, based on his symptoms and work exposure, recommend diagnostic tests like nerve conduction studies if necessary. Management. Implement job modifications, e.g. reduced vibration exposure, more breaks, provide ergonomic equipment such as anti-vibration gloves, initiate evidence-based treatment such as physiotherapy, prevention, educate Tom and coworkers on the risks of prolonged vibration exposure, recommend periodic health screenings for at-risk workers, relevant guideline. The NIOSH guidelines on vibration exposure provide limits to minimize health risks. How do evidence-based treatment protocols improve the management of workplace injuries, and what is the role of the occupational health nurse in ensuring these protocols are followed? Answer: evidence-based treatment protocols are essential for providing effective, standardized care for workplace injuries. These protocols are derived from research and clinical guidelines, ensuring that the treatments provided are the most effective, scientifically supported methods. Their role in improving injury management includes standardizing care. Protocols ensure that all workers receive consistent and appropriate care based on the most recent evidence, minimizing variations in treatment approaches. Improving recovery outcomes. By utilizing treatment supported by research, workers are more likely to experience better recovery outcomes, reduced complications, and faster return to work rates. Reducing costs. Implementing evidence-based practices can help reduce unnecessary treatments, medical tests, and prolonged absences, leading to lower healthcare costs for the employer. Guiding clinical decisions. The occupational health nurse is responsible for implementing these protocols by assessing the worker's injury, determining the appropriate course of action, and following the prescribed guidelines for treatment. The nurse also ensures that workers are referred to specialists if necessary, based on the evidence-based protocols for specific injuries, e.g., musculoskeletal injuries, burns, or lacerations. Continuous evaluation. The occupational health nurse must monitor and evaluate the effectiveness of the protocols regularly, ensuring that updates from new research are incorporated into the workplace health plan. Guideline. The American College of Occupational and Environmental Medicine (ACOEM) provides evidence-based guidelines for occupational injury management, which should be followed to ensure the best outcomes for workers. How does the application of a cohort study differ from a case control study in evaluating workplace health trends? Provide an example. Answer: a cohort study follows a group of workers over time to observe outcomes, e.g., the incidence of a specific occupational disease, often prospectively. It helps establish temporal relationships between exposures and outcomes, but is resource intensive. For instance, if workers in a chemical plant are exposed to benzene, a cohort study would follow both exposed and non-exposed groups over years to track the incidence of leukemia. A case control study, conversely, is retrospective. It identifies workers who already have the disease cases and compares their past exposures to controls without the disease. This method is quicker and less expensive, but susceptible to recall bias. Example: a case control study could examine workers with lung cancer and determine if they were more likely exposed to asbestos compared to healthy workers. Key considerations. Cohort studies are better for rare exposures but may take years to yield results. Case control studies are suitable for rare diseases but can misclassify exposure data. Explain the hierarchy of controls and provide a workplace example for each level. Answer: least effective, elimination, removing the hazard entirely. Example: discontinuing the use of a toxic solvent and replacing the process with water-based cleaning. Substitution, replacing the hazard with something safer. Example: using lead-free solder instead of lead-based solder. Engineering controls, isolating workers from hazards. Example: installing ventilation systems to reduce exposure to fumes. Administrative controls, changing work procedures. Example: rotating workers to limit individual exposure to repetitive strain. Personal protective equipment (PPE), using protective gear. Example: providing respirators for workers exposed to dust. Relevant standard. OSHA mandates applying the hierarchy of controls as a best practice in workplace hazard management. 29 CFR 1910. Maria is an occupational health nurse in a factory that recently experienced several slip and fall injuries. The injuries occurred in the packaging area, where floors are often wet due to spilled liquids. Management wants to reduce these incidents. What steps should Maria recommend using the hierarchy of controls, and why? Answer: Maria should recommend steps in the following order. Elimination. Address the root cause by eliminating liquid spills through better process controls, e.g. sealed packaging equipment. Substitution. Use spill-resistant materials or equipment to minimize the likelihood of wet floors. Engineering controls. Install anti-slip flooring or drainage systems to reduce slip risk. Administrative controls. Train employees on immediate spill cleanup and enforce a spill reporting protocol. PPE. Provide anti-slip footwear to workers. These measures systematically reduce hazards. Maria should emphasize higher-tier controls, elimination, substitution for long-term effectiveness and sustainability. This aligns with OSHA's general duty calls to ensure a hazard-free workplace. What is the importance of morbidity and mortality reviews in occupational health surveillance, and what data sources can be used? Answer: morbidity and mortality reviews identify workplace trends in illness and fatalities, allowing targeted interventions. These reviews are essential to detect patterns in disease or injury incidents, evaluate the effectiveness of current workplace safety measures, comply with regulatory reporting, e.g. OSHA. Data sources include OSHA 300 logs for tracking workplace injuries and illnesses, workers' compensation claims, highlight recurring injury types, medical records and autopsy reports, offer clinical insights, employee health screenings, reveal early indicators of disease, guideline, the OSHA Injury and Illness Record-Keeping Standard 29 CFR 1904 requires accurate reporting of workplace incidents for such analyses. Describe effective measures to prevent heat stress in workers exposed to high-temperature environments. Answer: heat stress can lead to serious health issues such as heat exhaustion and heat stroke, especially for workers in industries like construction or manufacturing. Effective preventive measures include engineering controls. Installing ventilation systems, air conditioning, or fans in the workspace helps reduce ambient temperatures, preventing heat buildup. Work practices. Implementing work rest cycles is crucial, ensuring workers take regular breaks in cool areas to recover from the heat. Hydration is critical, so access to water stations is essential. Training. Workers should be trained to recognize the signs of heat stress, such as dizziness, nausea, or confusion, and know when to seek medical attention. Personal protective equipment, PPE. In environments where cooling methods aren't sufficient, cooling vests or light-colored, breathable clothing can help. OSHA's technical manual on heat stress provides specific guidelines, including using the wet bulb globe temperature buoy index to determine acceptable heat exposure limits. This manual suggests limiting exposure times and incorporating sufficient cooling measures in the workplace to prevent serious health risks. How can occupational health nurses use epidemiological tools to create actionable reports for management? Answer: occupational health nurses play a critical role in utilizing epidemiological tools to identify and mitigate health risks. They can use cohort studies to track the long-term health outcomes of workers exposed to specific hazards, such as chemicals or repetitive strain. By following these workers over time, nurses can identify disease trends and correlate them with exposures. Additionally, case control studies can be employed to compare workers with health conditions, cases against healthy workers, controls, helping identify significant risk factors that contribute to illness. This can be particularly useful when investigating sudden outbreaks or rare diseases. Surveillance data, such as the OSHA 300 log, can be analyzed to detect patterns in injuries or illnesses within a specific period. By reviewing this data, nurses can determine if workplace conditions have contributed to these health issues. Finally, actionable reports should present data findings such as injury trends or potential exposure risks, along with recommendations for workplace improvements. These reports can then be used to advise management on interventions like increased safety measures or changes in policy. Jack, an occupational health nurse, notices a spike in respiratory complaints among welders. Workers report symptoms worsening after shifts. Using epidemiological tools, how should Jack investigate this issue? Answer: Jack should begin by conducting a thorough cohort study where he tracks the respiratory health of welders over time to compare the incidence of symptoms. He should also collect baseline data on the workers' exposure to fumes, welding materials, and any protective measures like respirators in place. This will help establish if a significant correlation exists between exposure and respiratory complaints. Next, Jack can utilize a case control study comparing welders who reported symptoms against those who did not, analyzing their respective exposure histories. This can help pinpoint potential contributing factors such as inadequate ventilation or certain materials used during the welding process. Jack should also perform air quality measurements in the welding areas to assess the levels of toxic fumes like methyl fumes and particulate matter, comparing them to OSHA's permissible exposure limits (PERLs). This data will help determine if exposure levels exceed safe thresholds. Lastly, Jack should compile these findings into a report recommending interventions such as improving ventilation systems, introducing better PPE, and implementing a more rigorous health surveillance program. What are the critical elements of building a safety culture in the workplace? Answer: building a safety culture in the workplace requires a collective effort from both management and employees. Key elements include leadership commitment. Senior management must prioritize safety not just as a policy but as a core value. This commitment should be evident through regular safety meetings, visible involvement in safety initiatives, and adequate resource allocation for safety programs. Employee involvement. Workers should be actively engaged in identifying and mitigating hazards. Regular safety meetings, safety audits, and open lines of communication help employees take ownership of their own safety. Training and education. Continuous education on safety practices, hazard identification, and emergency procedures ensures that all employees are aware of the risks they face and how to mitigate them. Transparent communication. A strong safety culture encourages reporting near misses, unsafe conditions, and potential hazards without fear of reprisal. This fosters a sense of trust between workers and management. Regular evaluation. Safety performance should be regularly evaluated using key metrics, and safety programs should be adapted based on the outcomes. What are the benefits and challenges of using the OSHA 300 log for tracking workplace injuries? Answer: the OSHA 300 log is a vital tool for tracking workplace injuries and illnesses, providing both benefits and challenges. Benefits: standardization. The log provides a standardized method for recording work-related injuries, allowing for consistency in reporting across industries. Trend identification. It allows organizations to track trends in injuries and illnesses over time, helping to identify patterns and areas that require intervention. Regulatory compliance. OSHA requires employers to maintain these logs, ensuring compliance with safety standards and helping to prevent workplace injuries. Challenges: underreporting. Employees may fail to report minor injuries due to fear of retaliation or lack of knowledge about the reporting process. Misclassification. Incorrect classification of injuries can skew data, leading to inaccurate analyses and ineffective interventions. Limited detail. The log provides basic injury information, but it doesn't include detailed data on specific exposures, making it less effective for in-depth risk assessment. Discuss the key differences between administrative controls and engineering controls in injury prevention with examples. Answer: engineering controls aim to eliminate or isolate the hazard at its source, providing long-term protection for workers. Examples include installing machine guards to prevent injuries from moving parts or using local exhaust ventilation to remove toxic fumes. These controls are typically more effective because they do not rely on worker behavior and are more sustainable. In contrast, administrative controls focus on changing the way work is organized and carried out. These controls may involve policies, procedures, or schedules designed to reduce worker exposure. Examples include rotating workers to reduce the risk of repetitive strain injuries or limiting the amount of time workers are exposed to a hazardous environment. While engineering controls are more effective and reliable, they can be costly to implement. Administrative controls are less expensive but require consistent monitoring and worker compliance to be effective. The OSHA hierarchy of controls recommends implementing engineering controls first, as they are more effective at eliminating or controlling risks directly. Administrative controls should be used when engineering solutions are not feasible or as complementary measures. How do personal protective equipment (PPE) requirements vary across different industries, and what factors should be considered when selecting appropriate PPE? Answer: personal protective equipment (PPE) is essential to safeguard workers from various workplace hazards. The types of PPE required can vary significantly depending on the industry, the specific risks involved, and the tasks being performed. In the construction industry, PPE may include hard hats, safety boots, gloves, high-visibility vests, and eye protection, as workers are exposed to physical hazards like falling objects and heavy machinery. In the healthcare industry, PPE, such as masks, gloves, gowns, and face shields, are necessary to prevent exposure to infectious diseases, chemicals, and bodily fluids. When selecting appropriate PPE, several factors must be considered. Hazard assessment. A thorough evaluation of the workplace hazards, such as chemical, biological, physical, or ergonomic risks will dictate the PPE required. For example, worker handling hazardous chemicals would require chemical-resistant gloves and aprons. Fit and comfort. PPE must fit properly to be effective. Ill-fitting equipment may not provide the required protection and can lead to injury. This is particularly crucial in the healthcare setting where comfort ensures compliance during long shifts. Work conditions. Environmental conditions like temperature, humidity, and the potential for heat stress should influence the selection of PPE. For instance, workers in hot environments may need cooling vests in addition to basic PPE. Compliance with standards. PPE must meet the standards set by OSHA or relevant regulatory bodies, e.g. ANSI for eye protection, NIOSH for respirators. Regulations ensure that PPE offers adequate protection against the identified hazards. The OSHA Personal Protective Equipment (PPE) Standard 29 CFR 1910.132 mandates that employers conduct hazard assessments and ensure appropriate PPE is provided. Explain how an occupational health nurse can use morbidity and mortality data to improve workplace health. Answer: morbidity and mortality data are valuable tools for identifying health trends and potential workplace hazards. By tracking illness and injury rates, an occupational health nurse can gain insights into the primary health risks in a particular workforce, thereby allowing for targeted interventions. Here's how morbidity and mortality data can be used. Trend analysis. The nurse can review morbidity, illness-related, and mortality, death-related data over time to identify any increasing trends or patterns that may suggest emerging hazards or ineffective safety protocols. For example, a rise in respiratory illnesses may indicate poor air quality in a factory. Risk factor identification. By analyzing mortality data, particularly from workplace-related deaths, OH&S can identify risk factors associated with particular jobs or tasks. This could include examining whether certain occupations have higher mortality rates due to accidents, chemical exposure, or chronic diseases like cancer in construction workers. Health risk reports. OH&S can compile these findings into actionable reports that provide management with a clear understanding of workplace health challenges. These reports can include recommended changes, such as introducing new PPE, improving ventilation, or enhancing worker training on safety protocols. Targeted prevention programs. Using morbidity data to identify the most common illnesses and injuries, OH&S can develop specific prevention programs. For example, if musculoskeletal injuries are prevalent, a nurse may recommend ergonomic assessments and training on proper lifting techniques. Collaborating with epidemiologists. OH&S can collaborate with epidemiologists to further refine the data and develop more in-depth studies on occupational illnesses, thereby enhancing the overall effectiveness of workplace health programs. The CDC National Institute for Occupational Safety and Health (NIOSH) provides guidelines for collecting and using such data to prevent injuries and illnesses in the workplace. David, a construction worker, has consistently elevated blood pressure readings during workplace screenings conducted by the occupational health nurse. He has not sought medical care despite repeated advice. What actions should the occupational health nurse take to address David's condition and its potential workplace impact? Answer: the nurse should educate David, emphasize the risks of untreated hypertension, including stroke and cardiovascular issues, provide referrals, assist David in accessing a healthcare provider for further evaluation, monitor workplace risks, assess if his condition could affect safety-sensitive tasks, such as operating heavy machinery, confidentiality compliance, ensure all health information is handled per HIPAA regulations, develop a wellness plan, offer tailored programs such as stress management, dietary counseling, and exercise routines. Describe the occupational health nurse's role during a disaster triage in a mass casualty event, including the triage protocols and key considerations for prioritizing care. Answer: during a mass casualty event, the occupational health nurse's role is crucial in implementing disaster triage protocols, which prioritize care based on the severity of injuries. The key steps include triage classification. Utilize the START simple triage and rapid treatment system, which categorizes patients into 4 groups: red immediate, severe injuries life-threatening requiring immediate attention, e.g. major bleeding, airway compromise; yellow delayed, serious injuries but can wait for treatment, e.g. broken bones, moderate burns; green minimal, minor injuries or walking wounded, e.g. minor cuts, abrasions; black deceased expectant, no chance of survival due to severe injuries such as massive head trauma. Rapid assessment. quickly assess each individual to determine the level of urgency using basic life-saving interventions. Communication. Maintain clear communication with emergency teams and dispatchers. Psychosocial support. Provide psychological first aid to both patients and responders. Key considerations. OSHA's Emergency Response Regulations 29 CFR 1910.120 ensures that workers are trained to handle hazardous materials safely during a disaster. Public health law. The nurse must follow disaster response protocols set by local health authorities, e.g., CDC guidelines. What are the legal and ethical implications of conducting health screenings for employees in the workplace, and how should occupational health nurses ensure compliance with these requirements? Answer. Health screenings in the workplace must balance legal requirements with ethical considerations. The key legal and ethical issues include informed consent. Employees must voluntarily consent to health screenings with clear communication about the purpose, risks, and benefits. Failure to obtain informed consent can lead to legal challenges. Confidentiality. Health information must be protected under HIPAA, Health Insurance Portability and Accountability Act in the U.S., or similar privacy laws in other jurisdictions. This includes securing medical records and limiting access to authorized personnel. Non-discrimination. Health screenings must be non-discriminatory, meaning employers cannot use screening results to make employment decisions such as hiring, promotion, or firing. This aligns with the Americans with Disabilities Act (ADA). Voluntary participation. Employers should ensure that employees are not coerced into participating in screenings. The Genetic Information Non-Discrimination Act (GINA) prohibits discrimination based on genetic information in employment. Compliance strategies. Implement written policies regarding screening procedures, confidentiality, and employee rights. Train occupational health staff on legal and ethical requirements. Offer alternatives for employees who refuse to participate without penalty. John, the truck driver, has been diagnosed with hypertension after routine health screening at work. He is required to drive long hours, and his hypertension could pose a risk to his health and safety. Despite the diagnosis, John has not changed his behavior and continues to drive without seeking further medical care. As an occupational health nurse, how should you handle John's case, ensuring both his health and compliance with workplace safety regulations? Answer. The occupational health nurse should take the following steps. Engage in counseling. Have a private conversation with John to educate him about the risks of uncontrolled hypertension, particularly its impact on his ability to safely operate a vehicle. Provide medical referrals. Recommend that John see a healthcare provider for treatment and management of his condition. Offer to assist in coordinating the referral. Assess fitness for duty. As per OSHA's General Duty Clause 29 U.S.C. 654, ensure that John is medically fit to perform his duties. This may involve working with his doctor to assess whether his condition poses a risk to workplace safety. Encourage lifestyle changes. Offer resources such as nutrition programs, stress management techniques, and physical activity options that could help John manage his condition. Confidentiality compliance. Ensure all health-related information is kept confidential according to HIPAA or other relevant privacy laws. In situations where John's health might pose an immediate risk to safety, e.g., seizures or loss of consciousness while driving, the nurse may be required to report concerns to the employer, particularly in safety-sensitive positions. What are the primary components of a comprehensive wellness program aimed at improving mental health in the workplace, and how should success be evaluated? Answer. A comprehensive wellness program for mental health should include mental health education, offer workshops and resources that address topics such as stress management, coping strategies, and recognizing mental health issues, access to counseling services, provide employees with access to counseling, employee assistance programs, EAPS, and mental health professionals, promotion of work-life balance, encourage flexible working hours, remote work options, and breaks to reduce burnout and stress, stigma reduction, foster an open culture where employees feel comfortable discussing mental health issues without fear of discrimination, support for high-stress occupations, focus on areas with higher stress levels, e.g., healthcare workers, by providing specific support programs. Evaluation metrics. Absenteeism and presenteeism rates. Track any changes in absenteeism and productivity due to mental health concerns. Employee feedback. Collect survey responses to assess employee satisfaction with mental health support. Healthcare utilization. Analyze the usage of mental health services such as counseling or EAP resources. Compliance. ensure that the program complies with OSHA's mental health guidelines and any local labor laws that mandate accommodations for mental health.